And I just wanted to let you know that Chairman Smith or Representative Smith put the balanced billing bill on notice for next week in the subcommittee. Along.
Good morning, ladies and gentlemen. This is on. Okay. Today is March 9, 2021. The time is 9:02. The Insurance Committee of the Tennessee House of Representatives of the 112th General Assembly is now in session. Clerk, please call the roll.
Representatives Carr, Sapicki, Freeman, Hawk, Hicks, Hodges, Johnson, Kumar, Lafferty, Mitchell, Powers, Rudd, Smith, Terry, Thompson, White, Vice Chair Rudder, Chairman Kumar.
Here.
Mr. Chairman, you have a quorum.
Thank you, Mr. Clerk. Members, do we have any personal orders? Just as a reminder, we did send by email the committee rules to you about 2 weeks ago. I hope you have received them and read them. And if you need another copy, kindly let us know. We have 4 items on the agenda. The first one is House Bill 0516 by Leader Gant. We have a motion and a second. Leader Gant, you're recognized.
Thank you, Mr. Chairman and committee. I'll be quick here. This bill, what this bill does is it allows, it's all around legal service plans, and consumers who join a legal services plan pay a fixed monthly fee and have access to an attorney who can answer legal questions and provide basic legal services like preparing a will. These plans are important resource for working families to obtain access to affordable quality legal plans. These plans are currently deemed legal insurance, even though they do not assume any risk like traditional insurance company policies. The 1989 Tennessee Legal Insurance Act was broadly written and did not anticipate changing technology that allowed for certain affordable and consumer-friendly legal plans that are different from legal insurance plans. And all this bill is doing is it's just, this bill will modify the definition of legal insurance in the Tennessee Legal Insurance Act to exclude non-insurance-based legal service plans. With that, I submit it back to you, and I'll be glad to answer any questions.
Well, thank you for the explanation. Chairman Spickey, you're recognized.
Thank you, Mr. Chairman. Just a quick example.
Well, you've got different, and I think there is some examples here in my notes, but it's basically about legal services that are provided by non-insurance company. And somehow that got caught up in the Tennessee Legal Insurance Act. So all we're doing is just modifying that definition to exclude that.
You're recognized.
Would that be like a legal Zoom or something like that?
Yes.
Thank you.
Members, any? Seeing none, if there's no objection, we are voting on House Bill 0516. All those in favor, please say aye. Aye. Opposed? Ayes prevail. The bill goes on to Finance Committee. And next item, House Bill 0523. Leader Gant, you're recognized.
Thank you, Chairman and committee.
We have a motion and a second.
This bill deals with assignment of benefits for property and casualty insurance policy. It keeps the status quo on existing insurance policies and claims handling. The General Assembly established public policy on assignment of benefits for health insurance, but has never spoken on the issue for property and casualty insurance. This bill does not dictate that property and casualty benefits can or cannot be assigned, it affirms that unless the General Assembly establishes policy on assignment, the insurance contractual terms are valid. And Mr. Chairman, if I could, I need to read some legislative history into the record with your indulgence, if I could, please.
You recognize.
This bill is not intended to affect any rights a party may have under existing law to arrange for proceeds of property damage to be paid to a third party who has purchased the damaged property. For example, a commercial property owner may arrange for the buyer to obtain insurance proceeds for repair of the property. This bill is not intended to abrogate or create the right of the seller to make such arrangement. Additionally, this bill is not intended to affect any limited or specific assignments of claims proceeded made following emergency or immediate property repairs. Some insurers in this discretion allow these limited assignment of proceeds during the emergency property repairs. This bill is not intended to abrogate or create any rights to make such an assignment, nor is it intended to change how companies currently handle existing claims.
Well, thank you for the explanation. So if the policy does not say that the benefits are assignable, then the policyholder cannot make an assignment if it is silent on it.
Yeah, that is correct. In Tennessee, and most insurance companies do not recognize assignment of benefits.
Can the consumers then be misled thinking they would
Yes.
be able to assign it?
Yes, that's the
And
purpose of this legislation.
does there need to be education along those lines, or should the policy have to state that the benefits are assignable or
Chairman.
not assignable?
Yeah, Chairman, that's a good question. As I'm an insurance agent, that's my job to make sure they understand the rights under their policy as their agent.
So it is up to the agent to educate the purchaser, but the policy itself will not state whether the benefits are assignable or not assignable.
That is correct.
Do we need to put a box on the policies?
Well, no, let me rephrase what you said. In most insurance contracts, it does recognize there is not assignment of benefits portion in that.
Members have any questions? Chairman White, you're recognized.
Thank you, Chairman. Just for the record, I think what you read into the record answers my question, but I know there were a couple of groups, legitimate groups that were questioning this. Did y'all get that worked out?
Chairman, thanks for reminding me about that. We have met and we have addressed their concerns, and they seem to be in a good posture at this point.
Okay, thank you very much.
Any other questions, members? Seeing none, and without objection, we are voting on House Bill 0523. All those in favor, please say aye. Aye. Opposed? The ayes prevail. The
Thank you,
bill
Mr.
goes
Chairman and
on
committee.
to calendar and rules. Thank you, Leader Gann. Our next item on the agenda is House Bill 0461 by Chairman Reedy.
Thank you, Mr. Chairman and committee. Mr. Chairman, there is an amendment. Do we need to put that on at this time?
Yes, we should.
And that amendment number, the drafting code is 3843.
Yes, it is. You're correct, 003843. Do you want to attach the amendment and then explain the bill as amended?
Yeah, because it just totally makes the bill. Yes, sir.
Without objection, members, we are voting on amendments 003843 to be attached to House Bill 0461. All those in favor, please say aye. Aye. Opposed? The amendment goes on the bill. You're recognized on House Bill 0461 as amended.
Thank you, Mr. Chairman. And for clarity, I will read this into the record. Amendment 3843 makes the bill and changes two dates within code to extend the ground ambulance assessment to June 30th of 2022. The ground ambulance assessment was created several years ago to help fill the gap between the expenses incurred by ambulance services to perform a transport and what Medicaid reimbursements for this transport. Without using any state dollars, the ground ambulance service paid to fund that draws down over $20 million in federal funds that is then paid back out to these services based on their Medicaid transport reports. Let's see. House Bill 461 as amended will extend the ground ambulance assessment for another year. And so each year I bring it back just to extend it for one more year, Mr. Chairman and committee.
Thank you. Members, any questions? Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chair. So I can get this right. So we're just trying to draw down more federal dollars for ground ambulance.
It's, yes, sir. A good example of that, it's many times the federal funds that the state of Tennessee gets is in matching funds. So the federal government will say, Representative Mitchell, we're going to give Tennessee for infrastructures, for roads, and we've got this $20 billion, but if Tennessee will match, and these are arbitrary numbers, if you'll send us 10 million, we'll give you the full fund back. So over the years, what has happened with the ground ambulance assessment, each run that the ground ambulance service provides, it's like $10 goes into a fund, and over the years it's been building up enough so they can match it at the federal level and then bring that money back so they get full reimbursement.
So it's kind of like Medicaid expansion for ground ambulance service.
To answer your question,
I withdraw my question.
I still appreciate you, but let's move on.
Well, that is a stretch. For the record, I would also like to once again emphasize that these are not federal dollars coming to us. They are dollars that the state of Tennessee has paid to the federal government, and our part of our share is being returned. This is for the hardworking Tennesseans' money. Chairman Speaker, you're recognized.
Thank you, Mr. Chairman. Representative Reed, thank you for bringing this bill. It's very important to us. And I want to say thank you to my colleague from Davidson County confirming my suspicions in his questioning about where he was going with this and understanding that leopards just can't change their spots. Thank you.
Members, any more venting required? We are good. All right. Without objection, we are voting on House Bill 0461. All those in favor, please say aye. Aye. Opposed? The ayes goes on to Finance Committee. Thank you, Chairman Reedy. The last item on our agenda is House Bill 0992 by Representative Love. We have a motion and a second. Representative Love, you're recognized.
Thank you, Mr. Chairman. Members, House, which will be known as Terrence's Law, it passes, is a bill to require the Bureau of TennCare to conduct an annual review of all medications and forms of treatment for sickle cell disease and services for enrollees with a diagnosis of sickle cell disease that are eligible for coverage under the Program of Medical Assistance Program, and requires the Bureau to solicit and consider input from the public when conducting the annual review. Also, Mr. Chairman, if I may, last time in the committee and subcommittee, I got a chance to talk a little bit about what sickle cell is, and I'd like to do that also if I can. Sickle cell disease is a disease where there's a group of inherited red blood cell disorders. Normal blood cells are healthy and donut-shaped and flow through the blood vessels very easily. Sickle cell blood cells are just like that, in the shape of a sickle. And the problem with them is that their lifespan is not as long because they don't carry as much oxygen to the organs as healthy blood cells do. The other problem is sickled cells oftentimes are described as very sticky in the bloodstream, and they oftentimes will clog up that bloodstream and don't allow the healthy blood cells to then flow to the organs. Now, the sickle cell disease also affects the lifespan of a person because they're oftentimes racked with pain, and currently the only cure for sickle cell disease is a bone marrow transplant or a stem cell transplant, which can be very tricky because you have to find bone marrow that matches the one you have. There are also some drugs that are used to mitigate the pain. And last time in subcommittee, we did talk about the fact that, you know, when persons present themselves to the doctor's office, they're racked with pain, and oftentimes people mistake them for being very addicted to the drugs, but it's because of the pain that they're enduring. And so this particular legislation, again, will require TennCare to review all of the current treatments and also solicit input from the general public. And Mr. Chairman, I apologize. Last time you asked a question, I didn't fully explain. You did ask about where I thought this particular bill would go, what kind of results it would yield. And my hope is that if TennCare is able to receive input from the public and from experts about what new treatments may be out there, then we can indeed reduce the number of deaths from persons out there. We also may be able to reduce the pain that the person experienced and also their families. And I'm open for questions.
Thank you, Representative Love. Just a minor clarification. I did not do it in finance. I had planned on sending you an email, not to publicly do this, but we're friends and you will not mind. The red blood cells are donut shaped, but without the donut hole. They are discs, basically, rather than the margins are thicker, but they're not truly donut shaped.
Correct. Sorry about that.
There are tremendous in treatment of this disease, and I think it will be even gene therapy and other things that are coming down the pipeline. I think there is genuine hope for treating this condition. You have named it Terence's Law. Who is Terence?
He is a cousin that died in 2016 from sickle cell disease.
Well, that's touching, and you're doing it. He's your cousin.
Yes.
Okay. Well, thank you for doing this. Members, do we have any other questions? Chairman White, you're recognized.
Thank you very much, Chairman. And my only question is, and so many of our population do suffer this, and I appreciate you bringing attention to this. It's a terrible disease. But we're talking about here, what is their position on whenever we pass legislation? I always want to make sure that it does what it's intended. And what is TennCare have a position on the ability to do this and to be effective moving forward?
They have not expressed to me any opposition to the legislation.
Okay, so, but, all right, so no opposition, but I just want to make sure that they can do what you want them to do is my question.
Yes, sir. I'll yield to Chairman Hawk.
Okay.
Chairman Hawk, you're recognized.
Thank you, Chairman Kumar, and Chairman White, thank you that. Representative Love, thank you for bringing this legislation, and not to speak for TennCare, but I will, just for prior positions on committees. This will be, I believe, the 21st different study that TennCare is including in some of their work. They were able to absorb it in what they're doing now in terms of study capacity. In the future, we may get to a bending point to where there will be a substantial cost to these studies. But this critically important issue to the state of Tennessee and to Representative Love will be able to fit within the parameters of what TennCare is doing at this time. And I'll look out to get a head nod from an individual just to ensure that I've mentioned what's right. But again, this study works within the confines of what TennCare can and will do. Thank you, Mr. Chairman.
Thank you for that clarification, Chairman Hawk. Chairman Smith, you're recognized.
Thank you, Chairman. And I want to thank you, the sponsor. One of the things that I know in working another bill that's near and dear to my heart about a consistent definition of medical necessity, as we're seeing healthcare innovations that really come down to the cellular level. And as Dr. Kumar mentioned, this is going to be responsive most likely to gene therapy because of the fact that this is personalized medicine and it's going to vary from person to person to person. It's going to be more important that our Tennessee code reflect the advances in medicine to match the therapies and not have a third-party administrator denying our citizens to have access to these types of therapies. So I want to thank the bill sponsor and thank you, Mr. Chairman, for pointing out the gene therapy is a wave of the future. But thank you, sir.
Thank you.
Thank you. Members, any other questions? Seeing none and without objection, Bill (992). All those in favor, please say aye. Aye. Opposed? The ayes prevail. The bill goes on to calendar and rules. Thank
Thank you,
you.
Mr. Chairman and committee members.
Thank you. Members, that completes our agenda. Any announcements or business? Seeing none, we stand adjourned. Thank you for your presence.